Good afternoon. I'm Giselle Corby-Smith, a professor of medicine at UNC School of Medicine and the director of the UNC Center for Health Equity Research, and I co-direct the Robert Wood Johnson Clinical Scholars Leadership Institute. We're welcoming you to Communities and Partnerships, Ensuring Equity in the Time of COVID. This webinar series is hosted by Community Campus Partnerships for Health and the UNC Center for Health Equity Research. The series is co-sponsored by the Robert Wood Johnson Clinical Scholars Institute, a national leadership program for experienced healthcare providers supported by the Robert Wood Johnson Foundation. We are excited to welcome you to our fourth session in an webinar series that has shared powerful and thoughtful information on the current health pandemic. Today's topic is another exciting one for you today. Joining me today as co-moderator is my longtime colleague, Al Richmond, Executive Director of Community Campus Partnerships for Health. Before we get started, we have a few ground rules. Your audio and phones will remain muted for the duration of the call. We've had an overwhelming response to these webinars. As many as 800 people have registered, and we want to make sure that we're able to use our time effectively and get you the information that you're looking for. Any questions you have to our speakers can be placed in the Q&A box. That's at the bottom of your screen. We will not be able to monitor the chat box for questions. That chat box, we really want you to message other attendees during the sessions and to be able to interact with each other. This webinar is being recorded. This and prior webinars are available on the CCPH and the CHER websites for review and to share with your networks. A little bit about today's session. As with many crises, the COVID-19 pandemic is having a disproportionate impact on LGBTQ+ communities, most especially Black, queer, and trans communities. This session will highlight the myriad of issues impacting those in these communities and demonstrate the ways in which individuals are using grassroots organizing to find practical solutions for equity in a system stacked against them.
Thank you, Giselle. We'd like to share with you the learning objectives for our webinar series. First, to share diverse perspectives on COVID-19 and its impact on health equity. Secondly, to develop a network, and you're part of that network, and it's a growing, expanding network to support systemic changes in response to COVID-19. And then finally, to evaluate collaborations and partnerships in underlying equity and the response to COVID-19.
At the bottom of your screen are our hashtags COVID, equity in COVID, as well as our handles. We would encourage you to go ahead and use that in your social media interactions so that we can continue to raise awareness about these issues. Our first speaker is a longtime colleague, Dr. David Malebranche, and we're excited to have him join us today. Dr. Malebranche is Assistant Professor of Medicine and Medical Director of Student and Employee Health at Morehouse School of Medicine. David, thanks so much for being here with us.
Thank you, Giselle. It's an honor to be here. And I will share my screen if everyone can see this okay, which I think they can. Let me see if I can do this a little bit bigger. Okay, so what I want to do, and I want to thank Giselle and Alan and everyone at UNC and CCPH for inviting me to participate in this. And I actually got promoted to associate professor a long time ago. So I know it said assistant professor earlier, that must have been a typo from that. And I'm going to talk a little bit about doing anything you can, Black LGBTQ plus communities during a pandemic. So first, looking at my background a little bit, I'm just showing you some pictures on the side. I'm the son of Roger and Donna Malebranche. My father is a Haitian immigrant, was a Haitian immigrant. He unfortunately passed in early January. And my mother is a second generation. Her family hails from the Ukraine and Austria. And you can see us in that picture in the middle when I was leaving the airport from them. I am a proud cis, same gender loving man. I'm a member of the Counter Narrative Project Tribe, which is the bottom picture in this slide, which is a community-based organization that is dedicated to advocacy and outreach and education of Black same-gender loving men. I'm an internal medicine physician. I focus on sexual health, HIV health, as well as student health, and I've dabbled in correctional health as well. I'm a public health activist, and I like to call myself a recovering academic. It seems like I always trace myself back to academia, and I try to leave, but it's almost like The Godfather. I get pulled back in every time I try to bounce. So this is a slide I presented actually at a webinar that we recently had a few days ago for the Gay Black Global Coalition. What we know and don't know about the United States regarding COVID-19. We do know that we have the highest number of cases and deaths globally here in the United States. There are inequities among Black and Latinx communities. Some of the risk factors associated with hospitalization and death we have from a New York City study of over 1,000 people. And the three most common comorbidities associated with hospitalization and death were hypertension, obesity, and diabetes. And interestingly, the HIV as a comorbidity was only present in about 2% of the hospitalizations. I mention that because that's been a big concern that I've been hearing ever since the COVID-19 pandemic took hold. People were asking, well, if I'm HIV positive, am I automatically at risk? And the answer to that, without having a lot of hard data yet, is, we're trying to encourage people to make sure they stay on their medications, maintain viral suppression, and that will protect you as it does from other opportunistic infections. And then finally, we have little specific data on LGBTQ plus communities. And one that I saw was published had about 80% white men and a similar sample size as the JAMA study in New York City with about 1,000 people. But to this date, I don't have a lot of information specifically surveying Black LGBTQ plus communities. So you look at this slide, it's talking about COVID-19's devastating impact on African Americans. You can see from the blue bars in these various states, how much of the state or city's population is African American. And then in the red bars, you're seeing the share of COVID-19 deaths. Again, we're seeing similar things that we see with other comorbid conditions or other health inequities, such as HIV, high blood pressure, coronary artery disease, seems to always disproportionately impact African Americans in this country. And recently, just yesterday, Greg Millett at AMFAR and his colleagues came out with a study. And the first bullet there talks about how we've had some data about Black Americans being at elevated risk, but about 70% of the current diagnoses nationally were unknown. We've had a lot of problems with reporting data and kind of collecting of race and ethnic data that has been problematic in tracing how these inequities are falling out. And we do know that there is a disparity, like I mentioned before, in inequity that we're seeing. And so what this study did, they compared COVID-19 cases and deaths in above average. And as you know, Black Americans, we make up about greater than 13% of the population here in the United States. And they compared Black counties versus all other US counties. What they found were about roughly 1 in 5 counties nationally is disproportionately or above average Black, and only represents about 35% of the US population, but accounts for nearly half of the COVID-19 cases and 58% of the COVID-19 deaths. And structural factors, one of the concluding statements in the report was that structural factors drive these disparities, not some kind of intrinsic genetic or individual level personal behavior deficiency that we have, which is the narrative you see a lot of times. And the website where you can get that report, it's pre-printed. I think they're going peer review right now and they should be out soon, but that's the link in case anyone wants to check that out. I have noticed a lot of parallels with the HIV care continuum, and you can see on the right part of this slide, life on the continuum of care, which includes HIV diagnosis, finding a healthcare provider, starting HIV treatment, and then the goal in keeping your viral load undetectable is included with taking care of your health, taking your HIV medications every day, seeing your healthcare provider regularly, and those things kind of are involved. And on the left side, you see with COVID-19, we're doing a lot of testing, linkage or / isolation with healthcare facilities, the possibility of treatment, but most of the treatment that we have is not specific prescription medication as with HIV, but it's more of conservative therapy, or if someone's hospitalized, more aggressive therapy that we're seeing. And then prevention, obviously you want to prevent, similar to how when you're living with HIV, you want to stay undetectable to prevent transmission with your sexual partners. For here, if it's COVID-19 that you're suspected or a confirmed case, you want to distance yourself, incorporate masks, hand washing, so on and so forth. I bring this slide up because when we talk about the HIV care continuum and we also talk about what's going on with COVID-19, we have to kind of mind the gaps. And it's great to have these bullet points that say, okay, we're doing testing, we're doing linkage, we're doing treatment, we're doing prevention, but you have to mind the gap about why these inequities are happening right now. And we speak specifically about this persistent anti-Blackness climate that we're seeing in the United States. And this young brother, Ahmaud Arbery, who just was shot down and practically lynched in broad daylight while he was out jogging, only 25 or 26 years old, just kind of shows you kind of the climate that we have in general, even before this pandemic took hold. And then I put a picture of a young lady named Deborah Gatewood, and I don't know if many of you read that story, but she was in Detroit and was a healthcare worker that went to get access to HIV, or not HIV, but COVID-19 testing about 2 or 3 times and was turned away several times, and then unfortunately died from severe COVID-19 infection. And you're seeing a lot of stories with this, and they're predominantly with Black and brown people that are coming up that are being turned away. So I bring all these stories up to say there's probably some testing and hospitalization bias. We have protocols that are there, and we know that we're deficient in testing, but still at the healthcare worker level, there can be some conscious or implicit bias that detects someone says, oh, you go home or you deserve a test. And I think some of those things are playing out that won't bear fruit in p-values or confidence intervals that we're seeing. And then finally, the 2 pictures at the bottom I have, one is of the Smithfield pork plant in Sioux Falls, South Dakota, and the other one's of Governor Brian Kemp in Georgia, talking about opening up early in what communities. And we've seen huge outbreaks of coronavirus in these meat processing facilities. And yet, even on the federal level, President Trump has stated that he wants to keep these facilities open. Then Brian Kemp, as you know, the governor of Georgia, was the last to actually have physical distancing and stay-at-home orders, and then also the first to reopen everything. So when you see these things, and then a lot of communities, we've been talking about, you know, hair salons, gyms, barbershops, and these are frequent small business locations that Black and brown people go to. So I think there's a lot of skepticism around communities about why exactly or what the intention is about opening up early. I share this next slide. This is a law professor, Richard Rothstein. A friend of mine just referred me to this book, and I have not read it yet, but it's called The Color of Law. And what it's talking about is how some governmental policies enforce segregation, which influence policies. And why I bring this slide up and I bring this book up is I think it provides some legal context as well to why we're seeing, when people are scratching their heads, well, why are there these racial inequities that we're seeing in COVID-19 and every other disease on the face of the earth? What we have to find out is that from this book, he's looking at the legal arguments and how federal, local, and state governments all were kind of complicit with certain laws that force segregation in communities, which influence policies, healthcare access, treatment, funding, so on and so forth. And I'm probably preaching to the choir by mentioning that fact. So where's the data on Black LGBTQ plus communities? Like I said before, there really hasn't been too much robust information that we've had yet, given that this pandemic is about 2 months old in the United States since we've been recognizing it. But there have been a lot of community-led initiatives. I refer people to thebody.com and Kenyon Farrell, who is a public health and journalistic beast, having webinars and giving educational sessions and articles on their website. And typically thebody.com focuses on HIV, but they've also become kind of a de facto COVID-19 hub as well. The Counter Narrative Project, the project that I'm involved in, we have a web series called Revolutionary Health. In the bottom left-hand corner, that's Michael Ward, who is the current host. And we'll have discussions anywhere from how COVID-19 is on a medical level, like some of the medical updates, how it's impacting nurses and nurses being on the front lines, to how it's impacting segments of Black gay communities, whether they be the bear community and whether mental health, substance abuse, sex workers, so on and so forth, and how it's feeding into all those kind of social aspects of our communities. And so Netherwood Consulting is another consulting group, and the Mobilizing Our Brothers initiative, MOBI as it's called, have been putting on webinars. Ring the Alarm was one of the ones that we had. Native Son with Emil Wilbekin has been doing the same thing. And I had the honor of working with the Chicago Black Gay Men's Caucus to do an update on COVID-19. I include this slide on some of these examples. This is only a handful, but a lot of the initiatives that we've been seeing have not been purely academic based, but more so grassroots from the community. And as an academic and as someone who has training in medicine and public health, I think the partnerships that we have in these kind of community-led grassroots initiatives are the ones that really need to start things off and include doing some of the research as we move forward. So for future directions, I say basically each one, teach one, which is almost, and I'm a Generation X, I'm a late 60s, I was born in 1969, but I'm a Generation Xer. And that was one of the big things in the 90s. We used to wear cross colors, a lot of Afrocentric garb all the time. And then one of the things we always used to wear was each one, teach one, talking about it's up to you to start small and teach one other person. It doesn't always have to be a big intervention. So when I say future directions, and I list some of these things, and we'll talk a little bit more about it when we have more questions and answers, I talk about some of the things we can do on a smaller level. So it may seem overwhelming right now, but this first bullet I'm talking about is future directions with connectedness with each other, supporting each other, empowering education. It doesn't have to be a funded research study. We can have Zoom calls with each other. We can reformulate how we meet in community-based organizations. And then there's always the question of sex and intimacy, which I know will come up later, and one of the registrants actually asked that question. But it's a great question to ask while we're physically distancing. Who is having a quarantine bay, what we're doing, what's safe, what's not. And those discussions need to be had, and I know we'll go into that a little bit further later. We also need to be protecting the most vulnerable among us, supporting our local healthcare workers with emotional support, obviously, masks and other PPE. So no matter what you're doing in the community, if you're a social worker, if you're a therapist, if you're someone who knows how to knit and sew, there are things you can do to help the local healthcare workers in your community with personal protective equipment, and also local community members to wear masks while we're being required to do so, that will help move things along and help kind of curb this pandemic. Then ensuring assistance with healthcare access and other needs, whether it be housing, food security, access to healthcare, telehealth, and meds. And then finally, right underneath that, ensuring assistance, I'm also talking about mental health, and that seems to be the big one. I just got off the phone earlier with a very good friend of mine who is only 44 years old, who just found out he was his COVID-19 test was positive with the nasal swab, and he was literally crying on the phone because we had a mutual friend who died recently, and his grandfather died of COVID-19. So a lot of us are really, really scared of what's going on. And support with hypertension, diabetes, coronary artery disease, lung disease, and HIV. When we talk about Black LGBTQ communities, we often just start as if it's only about sexual health and HIV. But as we are all getting older and we have generations of LGBTQ plus communities, we're realizing there are a lot of other health conditions and health issues that we have. It's not just HIV by itself. We have to encourage political activism beyond the CARES Act that provided some funding to small businesses, to the Ryan White and other kind of HIV-related organizations, and then studies for us, by us, both qualitative and quantitative. And then finally, I think this is an important point as well. While we're working on treatment and vaccine trials, making sure that we have representation from Black and brown people that are in those trials themselves, not only as the researchers and the principal investigators who are funded, but also making sure that the representation of the participants is equitable to what we see in the general population, and beyond that, equitable to what we're seeing in this health inequity right now. So I think that's it for me. I want to thank you guys again for listening. That's thebody.com and thecounternarrative.org. Those are the websites for that. And my contact information on social media and email is below if anyone has any questions or wants to reach out.
David, thanks so much for that fantastic presentation. I am going to read the questions and offer you some of the questions over the next few minutes that from people that registered for the webinar, and also suggest folks might want to use the Q&A box. One question was about the about whether we would have copies of the slides. What we can do is actually we're archiving all of these webinars on both the CCPH, Community Campus Partnerships for Health website, as well as the UNC School of Medicine Center for Health Equity Research. So you'll be able to access those webinar links there. And I want to also remind folks to use our social media handles and our hashtag equity in COVID as you all use your social media. So David, one of the questions that was that we got from one of the registrants are, what kind of tracking is actually being done to know how much the LGBTQ plus community has been affected by COVID-19? And what do we know except that people of color, Blacks and Latinx communities are affected the most?
Yeah, I don't think that has panned out yet. And I'll also, defer to Rissa and Tonya to answer some of those questions as well, because they may have some other additional information. But, the two states, I'm kind of bi-coastal and not bi-coastal, but bi-state in this regard. But New York and Georgia are kind of my my two states that I consider home. And the tracking that I've seen has included a lot of, zip code, education status, income level, and race ethnicity. And even that's been problematic to get that. There hasn't been really too much that I've seen in those two states and on a federal level that is really teased out into LGBTQ plus communities, outside of that one study that I mentioned in the presentation, where it was 80% white men that were in there. So I think we're going to see some of those studies both being done, and then hopefully, as they're doing the tracking data, they'll include those variables in their studies, and then we'll hopefully be able to garner more information. And we're also talking with the Counter Narrative Project, the organization I work with in Atlanta, about developing a survey to kind of target specifically Black gay men in the area and find out what's been going on about the impact of COVID-19, how it impacts other aspects of their lives, so on and so forth.
There's a question in the Q&A, but I'm going to go to one more question that is in the registration before I take that one. Do you have models, you've mentioned some examples of LGBTQ plus communities working together in coalitions or alliances that could be replicated, either from HIV to CHER, to address the issue in the LGBTQ plus community around COVID?
I think there's a lot of examples right now. And when I mentioned with groups like the Counter Narrative, MOBI, Netherwood Consulting, a lot of these organizations are also kind of bringing their efforts and their personnel and their resources together to provide information. And it tends to be, like I said, more of grassroots kind of education, empowerment, kind of getting the word out there. And then we have to bring some of the more academic part in it, where we're doing some surveys or qualitative exploration, so on and so forth. The one bigger one that I said was the Global Black Gay Men's Coalition or Caucus, which had a webinar. It was just this past Monday, which, you have Black gay men from all over the globe, from who are living in Europe, who are living in West Africa, living in the Caribbean, South America. And so having those kind of coalitions on a bigger level, talk about some of the policy changes that need to be coming out, some of the resources that need to be shared, sharing some of the information regarding some of the studies that we're doing in the different countries has been very helpful. And I do think those partnerships have been based in a lot of what we learned from the HIV epidemic and how kind of bringing these organizations together. And typically when you talk about funding, whether it be federal or global, they like to kind of pit us against each other. So it tends to be a kind of a crabs in a barrel thing, where it's like, well, okay, everyone's fighting over certain, and so we'll say, okay, Black people, then you have Black heterosexual women fighting against Black trans women, against Black non-gender conforming folk, against Black gay men. And so I think what we need to do is kind of pull all our resources together. And specifically when we're seeing racial disparities like this, the commonality is that we're all Black. So all of the different sexual orientations and gender identities fall underneath the Black community. And so if we can bring ourselves together and figure out what we have in some of the similar struggles that we're facing, then we can kind of pool our resources a little bit better.
I have one more question for you before we go to our next presentation. That was one from one of the registrants. In my work, I've heard from COVID positive folks that they're experiencing stigma from family, friends, coworkers due to their positive diagnosis. I would love to hear someone speak on how groups or organizations have been working to combat the layered stigma that queer people of color who are COVID positive have been facing, and what we can do as a community, as community members, academic or institutional partners.
Yeah, I've personally, I haven't heard of groups addressing that intersectional stigma or oppression just yet. But I know, again, I'll also throw that out to Marissa and Tonya to talk about as well, because I think what I've been doing myself, I know I've been doing a lot of one-on-one counseling with folks. I'm getting calls every day from community members, from good friends of mine, from family members that are undergoing this stigma. And when it's compounded with being Black, being trans, being gender non-conforming, being gay, being HIV positive as well, it really puts some pressure on folks. I think when we are doing our surveys, our qualitative assessments, any kind of research that's documenting what's happening with this, it's going to be important not to just focus on what the numbers are and splashing these headlines of, yeah, Black people make up a disproportionate percentage of, COVID-19 hospitalizations and deaths. We kind of anticipated that would happen, but I think what I would recommend people doing, whether in academic settings or not, is to focus on more of the narratives about the stories of the human beings that are behind these statistics, because COVID-19 is one virus. And I've always said with HIV, because of the structural issues, you could get rid of HIV. We could find a cure for HIV tomorrow. There's going to be another virus that's going to drop in its place. And because the structural issues have not been addressed yet, we're still going to have pandemics. And we're seeing that play out right now because people have conveniently forgotten about HIV. They're not talking about PEP, or treatment as prevention, or viral suppression, or U equals U. They're all talking about the panic of COVID-19. And so I think we have to be the ones that tell these stories, be the ones that document these stories, because other people are going to try to tell them for us. So we have to be intentional when we're doing these research studies and these needs assessments and talking to our own people in our own communities, that we are the ones that are telling our stories with these matters. Great.
Thank you so much. I'm going to pass this on to Al Richmond.
David and Giselle, thank you so much. It's just been amazing already. And I just want to acknowledge that you can continue this wonderful conversation after this by visiting CCPH's website to find out more about who we are as an organization, the work of UNC CHER, and to be part of a growing movement and conversation on these issues. We will also try to answer more questions in the Q&A box, so keep them coming. We'll do our very best there. So Tanya Petit is a faculty member in the Department of Social Medicine at the University of North Carolina at Chapel Hill. She is a clinician researcher trained as a physician assistant. Dr. Tanya has done a series of, lost my place here. Her work is focused on cultural awareness, gender affirming medical care for LGBTQ individuals since 1996, and conducted research in partnership with transgender communities since 2010. Her research is affiliated with the UNC Center for Health Equity Research and the UNC Center for AIDS Research. Tanya.
Thank you very much, Al. It's a pleasure to be on this amazing panel with the wonderful people who are able to join right now. I'm really happy to follow David Malbrand, who I think gave a beautiful overview of what we do know about the racial disparities related to COVID-19, and aptly indicated the limited amount of data we have specific to queer and trans LGBTQ people who are Black or of African descent. I do want to say that because David does a great job of talking about what is happening in Black gay communities, and Marissa, who is also a partner with me on several projects together, is going to speak, I think, beautifully about some of the work that's happening in Black trans communities. I'm going to focus most of my comments on a community that's often not visible and seen, which is Black, lesbian, and bisexual women. And I'm going to see if I can figure out how to share my slides. Let's see. Okay. So I'm assuming that y'all can see those slides.
Yes, we can.
Great. So ZAMI-NOBLA is a national organization of Black lesbians on aging. It's a national feminist organization of Black lesbians aged 40 years and older that promotes a positive aging through a social justice framework. And I'm going to start by talking a little bit about the work that ZAMI-NOBLA was doing prior to the COVID-19 pandemic, some of the work that the organization has done since the COVID-19 pandemic, and what we hope to do. I'm a member of ZAMI-NOBLA. Part of the mission is to use advocacy, culture, and the arts, as well as community-based programming and participatory research to connect to older Black lesbians. We fight actively against intersecting oppressions of racialized ableism, ageism, homophobia, racism, misogyny, classism, transphobia, and xenophobia, just to name a few of the things that we all face. One of the longest running projects of the ZAMI-NOBLA has been the Audre Lorde Scholarship Program, which provides funding for education for Black lesbians age 40 and older. And I think we're, a gazillion years into offering the scholarship fund. One of the newer projects is community building through Ukulele Griot Collective, and you can see some of the women who participate in the Griot Collective there. one of the members also donated a family home to provide housing for Black lesbian elders. So we're in the process towards the end of renovating that home, creating a community garden, so that it's an opportunity not only to provide housing for people who are struggling to find housing, as well as to provide an opportunity for people to learn about planting and growing their own food, to provide community and opportunities for people to get together in an affirming environment. The Zami Noba podcast is a sound source for Black lesbian history. And you can see there Angela Denise Davis, who runs that podcast, provides an opportunity for people to share their stories and communicate with one another. And the Chris, I'm going to mispronounce her name, Dukasen Advocacy Collective was named after a Zami Nobla member who passed away. And it's an opportunity for lesbians 50 and older to come together to form to learn from each other and to grow advocacy efforts to represent our needs, which are often invisible. So since the COVID-19 pandemic happened, there's been a greater need for community to come together virtually. There's been, as people have mentioned, a need for mental health and support resources. There's been a need for financial resources. And even though Zami Nobla is an organization that's small in budget, big in heart, there's been a lot of effort to reach out to community and provide some of those services through the online forum. So one of the things that Zami's done, as you can see on the far right, is provide a webinar on dollars and cents and financial management. That's been a long-running project of the group, but how specifically do we address financial concerns in the community in the time of COVID-19? On the bottom left, you'll see that there's been a yoga class that was started that is ongoing, a virtual yoga class to provide people an opportunity to center and be in their bodies and seek calm within their bodies. We all need to laugh. That's one of the ways that Black communities have survived through the decades. And Zami Nobla sponsored a comedy program with Karen Williams, who's a well-known Black lesbian comic. And also workshops with Dr. Dion Bates, who is a psychotherapist who provided information on stress reduction and how to manage in these stressful times. And Zami Nobla has long had a Black lesbian elder crisis fund and has actively sought resources to help replenish that fund and provide services for people in the community who need help, small grants with for food or housing support. And that funding to support some of these activities has been acquired from some of the urgent active funds and some of the other rapid response funds that have been available for community organizations. And we've talked a little bit about how little data there has been that has been available for our communities and about our communities. We are just beginning to get some of the data on racial disparities. But I would argue that in addition to information on disparities, that's just a starting point. And as David mentioned, we all knew that this was coming. It's not a surprise to us whenever there's a new issue that rises. Often our communities are most heavily impacted. What we are interested in doing is, what do we do about it now, right? So there have been organizations that have already been addressing some of the mental health concerns. David mentioned some of those. I mentioned some of the things that Zami Nobla is doing. Marissa will probably talk about some of the amazing work that trans organizations have been doing, like the Black Trans Advocacy Coalition, Translash, the Campaign for Southern Equality have been coming together to provide supportive environments for people to come together, provide education and information, but also to collect data on our community. And similarly, the Black lesbian community is through Zami Nobla is attempting to collect information from our constituency on what it is that we're experiencing in this time of COVID-19 and what we need and what we can do about it. So we are in IRB, under the IRB review right now, and hopefully we'll get approved to start conducting online surveys and focus groups. And I know I have gotten several emails asking me to fill out surveys, and I always try to do so when I can, because I feel like if I don't speak for my needs and my experiences, then nobody will know what they are. So I think that's all I wanted to say. I wanted to be really brief because I saw that there were a number of questions and concerns that people raised. And so I want to make sure we have plenty of time for that.
Thank you. I want to kind of get right into the questions. And one of them I think is in line with what you've been talking about this afternoon. And that is, what recommendations do you have for decreasing social isolation and economic inequities among poor and disabled LGBTQ elders at this particular time?
That is a great question. I've been very impressed by some of the philanthropic foundations that have come together to provide rapid response funds. And when they say rapid, they mean rapid. I've seen people apply and get funded within a week. So I think connecting with organizations that you know of in your area and encouraging them to apply, or if you are one of those organizations, apply for that rapid funding. I think even without that funding, we can reach out to our neighbors, to our friends. I live in Durham, North Carolina, which has a strong sort of community history, and people came together incredibly quickly to form mutual aid societies, to pool resources, to provide people with rides to the doctor, to provide people with, to call people who might be isolated and maybe don't have access to the internet to join some of these online support groups. But I think you can go big, like through organizations, or you can stay close to home and reach out to your neighbors and people in your community and your family and friends to offer a presence, even if it can't be physical, even if it has to be through a window. I have subjected my parents to talking to them from the porch through the window.
Another question is, how can those in the academy or in federal health roles tap into organizing and mutual aid strategically without co-opting tactics or making themselves more vulnerable at this point in time?
I want to make sure that I understand the question. So how can people...
Yeah, how can those who are in the academy or in a federal health role tap into organizing and mutually aid strategically without co-opting tactics or making themselves more vulnerable?
I see. I think reaching out to organizations and asking them what they need before offering to provide what you think they might need is a really collaborative way to approach anything. And I think Marissa will probably talk about some of the relationships that she's formed and how she's done that by leading with knowing her community and knowing what they need. And I think if you are a federal funder, if you are a community funder, if you're an academic who sees a need to collect data and do research, to approach people of the community and in the community who are already leading those organizations, probably already know the questions to ask, probably already know where funding is needed, and to offer that in partnership with them is going to be the best way to do so without sort of taking over and shifting priorities to places that are maybe more in line with your organization, but less in line with what the community needs.
Thank you. Appreciate that. We want to move to our next speaker, and we've all been talking to Marissa Miller this afternoon, and we're excited to have her join us this afternoon. Marissa is a nationally recognized advocate for human rights, social justice, health equity, and LGBTQ equality. Marissa has worked for the last 15 years on the local, state, and national levels to improve access to treatment and care for transgendered people and people living with HIV, as well as to erasing stigma and discrimination through education, policy, advocacy, and visibility. Marissa is now working to create change globally as the founder of Trans Solution. Marissa.
Thank you so much for the introduction, and thank you so much for my colleagues that preceded me. It is always a treat to sit with both Tonya and David at the same time, and I am grateful for the opportunity that I've had to nurture the relationship at University of North Carolina, Chapel Hill. One of the things that we decided prior to the phone call is I looked at the questions that were in the box, and we wanted to talk and get into the questions, but I did want to share a little bit about Trans Solutions. Trans Solutions was formed right after a project that I had did, which was the National Trans Visibility March. While putting together that march, Trans Solutions noticed that there were a lot of loopholes where safety was concerned with transgender individuals, not just violence, but space, the policy. And so what Trans Solutions does is we partnered with several academic agencies, and one of the projects that we are currently working on is we're looking at safety as it relates to HIV. And as we talk through some of the questions, I will share with you some of the projects that I am currently working with some of my academic partners at Johns Hopkins, North Carolina, Chapel Hill, Duke, to look at safety, as well as, there will be some questions in the chat box about data. A lot of people have had questions about, have data been collected where the Black community is concerned, where the LGBT community is concerned, where the trans community is concerned? Well, Tonya and I and another one of our colleagues are going to be working on a project. We're waiting to get the project funded, but we are going to look at the disparities of COVID-19 in a marginalized population, such as Black trans women or trans women of color. And so as we move and navigate through the questions, so for time's sake, I just wanted to make sure that we would have enough time to answer all of those particular questions. So you'll learn a little bit more about me and what we do at Translutions as we navigate through the questions, so that we can make this about you and not all about us. And so we can move forward with the questions, team.
Sure. So Marissa, thank you. So our first question is, what advice can you offer on how to best support young queer and trans people who may be sheltering in place with unsupportive families in homeless shelters or without a place to stay, especially with regards to privacy issues? This individual says they are a therapist and they're having a difficult time helping their clients.
Well, I think one of the most, and thank you so much for that question, because that's a very important question, and a lot of my colleagues across different spectrums have been having that discussion. I've partnered in another seat, the National Trans Visibility March. We've partnered with the CHER Project and with another national agency in Washington, D.C. called SMILE. Those are two wonderful resources. I know that the CHER Project has the CHER Chat, CHER Text, different methods of communication. So one of those resources, I think the CHER Project would be a great place to start as a therapist, to get some additional resources about how you can navigate through those particular conversations. I would also say to some of my community-based organizations that have programs and their doors are opening back up, it's really important that we continue to have the collective Zoom meetings and spaces that we have a safe area to have those discussions, because there are people that are at home with their parents and don't want to be there, can't exist in their gender, can't put on the clothes that are affirming. And so I know that the CHER Project and the network that they have across country has been doing a great job providing those resources. And you can go right to the CHER Project website, which is trevorproject.org, and you can tap right in their online operators. And also I wrote the number down just because I remembered that question. The number is 1-866-488-7386. Again, that's 866-488-7386. And that is a 24-hour hotline for CHER Project.
Thank you. So what mental health provisions are needed specifically at this time, again, to support people of color during this pandemic, and particularly those who may be gender non-conforming? Any thoughts, Melissa?
Well, mental health is mental health, and I don't know that mental health, and so it's certainly something that has been taboo. Let's start there historically, talking about therapy and mental health, because we've always taught people what goes on in the house stays in the house, and so we do disjustice when we ask people to manage their own trauma and manage their own pain. And so I think that there are several different accesses. If you're HIV positive, you certainly have the opportunity through Ryan White Part C to access mental health provisions. And you also have the opportunity through community-based organizations. I know a lot of therapists, I'll share very candidly, one of the stronger individuals, COVID-19 and the social isolation has made me begin to need to talk to my therapist again, just to talk about what it feels like, because social anxiety is a big thing, understanding what an introvert is and what an extrovert is and how they operate and how they, receive their power. So I think it's important that we address mental health. If you don't know how to do it and how to find a therapist, most times, I'm going to tell you one good network is Facebook. I'm telling you, you can go to Facebook and say, where can I find a Black therapist? Where can I find a therapist that accepts Medicaid, Medicare? But another thing that you can do is you can look on the back of your medical cards. If you have medical insurance, look on the back of that card. There's always a number on the back of that card. Dial that number. they will tell you which providers are in your particular area. Now, if you're looking for one that is maybe TGNC affirming, you can always visit our website, which is transsolutions.org. It's full of resources where people can navigate to find different medical provisions.
Marissa, one final question is from an individual that says, any suggestions on how to best reach trans women whose primary employment involves sex work, which has been dramatically impacted by the pandemic in New York in particular? Any thoughts there?
Well, you know, I looked at that question and I also want to say that the question also went on to say when being on the internet or being online is not successful. And so I thought about that a long time, because one thing I want to say on this phone call for recording purposes is that sex work is real work, and we have to continue to work to decriminalize sex work. That's not everybody's view, but that is the view that is best for trans people that are involved or people that are involved in sex work. I think that's not just an issue for the trans community. I think that anybody involved in sex work might have a question about how do we practice social distancing. I think that when you in this moment, we have to become very creative about how we have those conversations online, what methods of interest we use online. I also know that people that I have been talking to in the community, you know, because we've been able to provide rapid response to sex workers across countries so that they'll be able to at least have places to stay. A lot of sex workers depend on those particular interactions to provide housing, to provide basic needs. And so we've been able, through rapid response, through several different funding pools specifically for trans individuals, to be able to make sure that sex workers have some form of income. We've been paying phone bills. And so if you know sex workers out there, another good resource is Destination Tomorrow's Transcend Grant that is in New York. They are doing rapid response work. It's called the Transcend Grant. It's a Gilead-funded project to do work specifically with Black and Brown communities. And so they have funded several different agencies to do rapid response, but it also would do due diligence to contact Transcend, or to contact Destination Tomorrow, or contact us at Trans Solutions. Contact us at Trans Solutions and tell us that you can't navigate life because you can't go outside. We would rather find a way for you to navigate and keep you safe while social distancing and cities are shut down versus you going out there and cause harm. And I think the last thing I would say, and you know, I certainly come from the sex working population. A lot of what, you know, people have been doing that are involved in sex work have been resulting to what they call regulars. And so I wanted to offer all of the resources that I have been able to get from having conversations with people. But do the first two first. Contact Destination Tomorrow, contact Brave Space Alliance in Chicago, contact Ariana Center in Florida, contact Unique Women's Coalition in LA, contact us at Trans Solutions, and we will direct you to those particular pockets of places that have resources that are specifically looking out for our sex worker community.
Thank you. Marissa, thank you for your courage and thank you for your leadership. We want to open our, use the remaining time to kind of open up the discussion to invite all of our panelists in, and I think that would be really great. I want to acknowledge that one of the participants today acknowledged that we should actually include subtitles and closed caption text for those persons who are in need of those. We appreciate that feedback, and we will take that under advisement. We also would encourage you to provide additional feedback regarding this webinar series, including topics as well as speakers for future sessions as well. So I'm going to kind of transition in. Giselle, if you're able, if you could just kind of facilitate kind of the next phase in terms of additional questions.
Thanks, Al. So one of the questions that we ask all of our panelists is, given the state of inequality in the trans or LGBTQ+ populations and COVID-19, what are some of the things that you feel that we need to be focusing on as a community to address those inequities? Either the policy, interpersonal, personal kinds of things that we need to be focusing on. And I'll start by asking David your thoughts on this.
Yeah, I think it's a great question. And I think it's multi-level. As Marissa was talking, I was just thinking about all the stigma that's happening with COVID-19 against sex workers, as she pointed out, that I've heard that time and time again. And not only just sex workers, but anyone that wants to connect and have some kind of physical intimacy. If somebody's doing that, they're being judged. And also because obesity has been identified as one of the comorbid conditions that increases hospitalization and death, people have been saying, well, it's your own fault, stop eating. And it's kind of led into this obesity shaming that people are experiencing as well. I just think there's so many levels that we can do solutions on. And I think the unfortunate climate in the United States particularly is that when there's, something that's going on that has an inequity among Black and brown people, it's usually saying, okay, well, you guys need to pick yourself up by your own bootstraps, stop smoking, stop drinking, stop doing drugs, stop doing all this stuff on an individual level. And there's no acknowledgement of the context. And then when you see a lot of the white pandemics that disproportionately affect white people, say, for example, the opioid pandemic, there's all this context around mental health and about how the doctors and their prescribing practices, and you see everybody moralized, but you don't see the addicts actually stigmatized the way it was in the crack epidemic. And so what's crystal clear to me is that a lot of our federal, state, and local governments have dropped the ball, particularly with Black and brown communities, because that's what they're used to doing. So COVID-19 is not any exception with regards to that. And so the unfortunate reality is it's not only just on ourselves to say, well, okay, these are the individual level things I can do, but also to start mobilizing on smaller levels. And I think, hearing what Tonya was saying, hearing what Marissa was saying, that's what we've had to do, is kind of our different facets of our community to kind of work in these policy arenas. And not only when we have, specifically, and I know a lot of people who are watching this right now are academic, some are in community-based organizations, some are in both, but I would encourage people, whether you're one or the other, if you're in a community-based organization and you have desires to get into academia or get at the table to influence policy or administration or research, partner with some of the people when these studies are happening, and mentorship can happen both ways. Or if you're an academic, don't just reach out to community-based organizations when you need to do a study. Take part, especially if you're members of the community, be a member of that community-based organization and do the work every day. Do work that's outside of the research and public health field, and be a part of the community as well, because then that mentorship and that two-way street of learning goes both ways. And so I think there's a lot we can do, but I think we just need more representation of us at the table. Because if it's not there, and I thank God for Greg Millett being at AmFAR, because that study that they just put out yesterday, that's Greg Millett. I've known Greg for 20 years. That is Greg Millett. That rigor that he used with the science and putting the graphs together, that's Greg Millett day in, day out, all day. And that kind of information, like, you want to see how quickly this happened. Jake Tapper from CNN retweeted what they published on AmFAR, that study. And so that has ripple effects. So if you put out a study like that, you can actually work on a macro level while we're doing these other things on a smaller, more local level. We can do bigger things as well. So I think it has to be both one-on-one levels, connecting with each other, supporting our families, both chosen and biologic, supporting our mental health, providing the services that we are experts at, as well as kind of getting into these bigger spaces and at bigger tables, getting seats at bigger tables. Or if you can't get a seat at one table, just make your own damn table and put it down there, create your own damn table, and then bring the people that you want at that table to make those decisions. But I think there's a lot of things we can do. And as we've said before, and I think this has been echoed by a couple of the other presentations, is that we have lessons that we've learned from the HIV epidemic and that we can apply here. So while COVID-19 is definitely a different virus, there are principles that we can incorporate here as we move forward that hopefully we learn from HIV that we can bring to the table here.
Thank you, David. Tonya and Marissa, I want to ask you about strategies for moving forward after COVID-19. What are your thoughts about how we as a community can move forward towards health equity after COVID-19?
Thank you. I think that's a great question. I think first we have to be honest. And I think that that's something we as a community, as a academic world, sometimes as a research community and several other areas refuse to have that honest conversation. In order for us to really transition what health equity looks like for most marginalized populations, we have to put them at the top of what liberation looks like. We always talk about like these models where you first didn't have a category for me. I was mapped in with men who have sex with men, and then you finally find a category for me, but then it's still at the bottom of the borough funding. And then you find another category where you say, I'm not gonna let you be Black and trans, I'm gonna make you be of color. So I'm gonna put you in this box as well. Then I'm not just gonna put you in this box, but I'm gonna put you in this box, and then I'm gonna make you talk about being non-binary and gender non-conforming. My experience as a Black trans woman is that I had to crawl from the bottom of the borough to get to the top of the borough. So when we talk about how we move health models, we have to talk about not always, how do we get to evidence-based practices? We get to them through experience-based practices. How did I get out the bottom of the borough? How did the other people get out of the bottom of the borough? Stop taking these models. I don't know where they come from, and if they do come from researchers, and my colleague David said, researchers inviting community to the table. No, don't just invite me to the table. Figure out how I can be published with you. Figure out how I can be a co-writer with you without a doctorate degree, because I did my dissertation. If you really look at the life that I lived and all of the journey that I've traveled and all the triumph and resilience I put in there, I'm doing my dissertation now during COVID-19. So does it qualify me to be a researcher? We have to change models. We have to not patronize and tokenize, but use us as beacons. Put us in positions of power along with you. Don't say we don't have the experience. Teach us the experience as you travel through there if you want to be effective. Because the 350s and 450s that you offer for us to mobilize your groups are not going to be enough. Because there's going to come a time that Black trans people are going to take all of our power back. And if you want to work with us, the funding is going to have to lie with us. You can no longer put and pit us against all of these populations and then wonder why we can't get along or wonder why we can't get to a cause. It's because you've pitted us. There is enough money. I want us to stop saying that.
Thank you so much,
Money we
Marissa.
have to distribute it properly.
Thank you so much. Tonya, your thoughts about moving forward after COVID. Marissa, thank you so much for your the power in what you've said. Thank you for sharing that.
And I want to 100,000%, if that's a number, agree with every word that Marissa said. And I also think that we can use that to build coalitions. As she mentioned, we don't need to pit against each other. We can work together for what we need. And I also think we cannot let elected officials off the hook. We are fabulous at making a way out of no way. We've been doing that for a long time. And those of us who have survived that way, it's been fabulous, but not all of us have. So if we bring our power together, if we recognize our common needs and our common ground and use that to hold elected officials accountable. There is an election in November, we hope. There are elections happening all around the country. There are local, very local elections. There are national elections. There are statewide elections. There are people who should not have the power to make policy, who've been making policy for a long time. And I've seen people act like we just have to wait for them to go away, like somehow people disappear. That's not what we have to do. We have to come together, use our collective power. If we do it in roll-by demonstrations because we can't get out of our car, if we do it 6 feet apart and standing in front of a state house, however we need to do it to make sure that the people that we pay tax money to, who are supposed to be accountable to us as a community for our survival and well-being, are held to account and provide for us what they need to provide for us, I think is just as important as us providing for one another.
Thank you so much, Tonya. We are at the top of our hour. This has been another incredibly powerful webinar. please make sure to check out the discussion board at CCPH's website to continue this conversation. Our next webinar will be next week on May 13th, and we'll be talking about the COVID-19 crisis in birthing people. And we have an incredible lineup of individuals to talk about what it's like to give birth and the framework that we need to be thinking about to have an equity lens about this. Please also use this QRS code to give us feedback. We want this webinar series to be what you want to hear, and so please use that to give us feedback so that we can continue to shape and mold this. Please stay updated and subscribe to CCPH's newsletter and visit the ccph.org/COVID-19 equity. Thank you so much for joining us today, and we look forward to seeing you and being with you again next week. Bye-bye.
Bye-bye.
Thanks, everybody. Bye-bye.